All right, let's get started. Good morning, everyone. I'm Larry Boris, Executive Director of the National Association. Excuse me. Excuse me. National National Association for Workplace Healthcare. And oh my goodness. And I want to thank you for joining us today to talk about our session, our topic. Topic is occupational health surveillance programs, design and implementation. Before we get into the topic, for those who may not be familiar, National Association for Workplace Healthcare is the new name for the National Association of Workplace Health Centers or Worksite Health Centers. We continue to be the nation's leading nonprofit group for employers, unions, other purchasers, as well as health providers and vendors who serve employers involved with both direct contracting for primary care, as well as for on-site, near-site, mobile, and virtual health centers. We assist both employers and purchasers and others who are health plan sponsors really understand the value of direct contracting and worksite centers and help them develop and increase the capabilities of these. And we work with their partners, the clinic vendors, health providers, et cetera, who are managing and also running centers for their own employees. This is one of monthly educational programs we have. We also have networking opportunities, benchmarking, purchasing support, and a clearinghouse of information. So please visit our website at nawhc.org to learn more about it and subscribe to our LinkedIn groups. Other programs coming up following today, as I said, we have almost two programs a month, which are free for NAWHC members. Next month, or later this month, we have how Bass Pro Shops is reeling in affordable medications for their members. November, we'll be covering clinic accessibility and COBRA issues. We'll also have one on rounding out direct primary care with employee wellness. There'll be our first on-site summit in-person meeting will be January 15th and 16th in Caesars Palace in Las Vegas. In February, we'll have a webinar on health center management, and then our annual forum will be on April 8th and 9th in St. Louis, employer managed healthcare, worksite clinics, and direct contracting strategies. So we hope you'll join us for one or many of these opportunities. So today's speaker, we're pleased to have Dawn Carey, Senior Director of Purdue HealthWorks at Purdue Farms. Dawn's a member of the NAWHC board and a well-known speaker throughout the country on worksite centers and particularly in occupational health. So with that, turn it over to you, Dawn. Thank you.
Thank you so much. Thank you. And you recovered really well.
Trying.
Thanks so right. Thanks so much for having me today, Larry. I'm excited to be able to talk about this topic. And for those of you who are on the phone, excited to talk about something other than open enrollment. Right now, at this point in time, for probably most of you, you're probably in the depths of planning for benefits for 2026. So it's nice to be able to get back to our foundation for Purdue, which is occupational health and health surveillance design and implementation. I should say that I am not the expert in this, of course. I've been at Purdue for about 12 years, and as things evolve and things change and people change and programs change and systems change, of course, our response changes as well. So I'm going to offer you up today what I know and what we do here at Purdue, and hopefully you'll take a nugget or two to be able to implement into your company as well. So next slide. Okay, the agenda for today, we'll talk a little bit about who we are as a company. We always like to talk about our product. We're really proud of our 105-year-old legacy at Purdue. We'll talk about the overview of the medical surveillance program. What does it mean to Purdue and what's it mean for your company? How we designed the surveillance program and how we implement that surveillance program. Key considerations if you're talking about developing one or sort of fine-tuning a surveillance program. best practices for sustaining an effective surveillance program, and then Larry will open it up for Q&A at the end of the session. These are our guys here. So I should share with you, and I sort of share when I can. First and foremost, really a proud member of Salisbury, Maryland, where Purdue sort of started and was established. I'm fortunate enough to sit across from this house here to the left bottom, which is our sort of starting point for our company. Here you will find our founding members of Purdue, family run business for 105 years. That would be Arthur, Jim, or Frank and Jim Purdue. So next slide. Of course, we are a fifth generation family owned business. We have about 20,000 associates across the company. We have 25 health centers across Purdue, managed by Purdue. And of course, for us, we have about 13,000 covered lives on our benefit plan. The next slide. And here's our, yep. So by the numbers here, from Purdue as a company, and I want to call out here at the bottom our slogan for no antibiotics ever, ever. We're really proud about the science behind our product, right? So there's a lot of market research, a lot of just research in general about, our product and how we deliver that product, how we process that product, how we deliver that product to make sure that we have a safe product for you and your family. So we're third in U.S. sales. We're 7%. We have 7% of the chicken market. We have top 10 among U.S. grain companies. I think people are sort of shocked to know that we do more than chicken. Not that chicken's not enough, but we do more than chicken. We have a premier meat company, which is a hog farm, cow farms, grain operations, pet treats, a lot of different dynamics to our business. We have about 21,000 associates here, 2,000 poultry farmers, 600 pork farmers, and 8,500 grain farmers at Purdue. Of course, our vision is to be the most trusted name in food and agricultural products. Again, that's something we pride ourselves in to make sure that we're offering a safe and quality product for you and your family. Okay, our values, this is the cornerstones of our business. Number one is always quality. Again, going back to the story of ensuring that what we deliver to you, we would eat ourselves, right? Been with Purdue for 12 years, been through definitely some culture changes, some leadership changes, and one of the best foundations we have at Purdue is the integrity of our business. We are people first mentality here at Purdue. So, we make sure that our associates are treated fairly, that our business is run with integrity. And then teamwork. We are what's considered one Purdue philosophy here. So no matter how many businesses we run, whether it be pet treats or grain operations or hog farms, we have one mentality, and that is we're moving our entire business forward. And then if you are fortunate enough to be able to keep up with the news in regards to community involvement, Purdue is at the cornerstone of stewardship in our community. Right now, we are supporting the hunger campaign for the month of October. We are always giving back in times of turmoil, whether it be a location that we have an operation in or not. So for example, if there is a weather event, we are there. And so it's a very important part of our business is that stewardship component. Okay. Our people goals, again, to remain first and foremost in our goals, people first mentality has helped guide our business for 105 years. Some of the excerpts that I have sort of gleaned from both our chairman and our CEO over the last few years, and these really stood out to me. And every year we set goals for 4 key areas, and it's people, products, planet, and profitability, with our people goals always first. We have a safety first mentality here at Purdue. And again, making sure that our folks, we like to say, they leave the way they come. And so we make sure that they are always put first here at Purdue. This orders intentionally and reflects the people philosophy of Purdue. Like I said, we have 25 health clinics across the country. So most recently, our Petaluma, California expanded into an on-site clinic in which we have about 40 contract providers that offer on-site health care to our associates and dependents, I should say. Our mission is to improve human health and bring about engaged, healthy, and productive associates. And our vision is to be the most trusted, successful, and efficient science-based medical team, maximizing the health of our customers. And we stay true to that in every decision that we make. Now, I'm going to give you an overview of what OSHA says about a medical surveillance program. And from an occupational health perspective, OSHA is our guiding light, right? So whether it be record keeping, medical surveillance, things like hepatitis B vaccines, flu vaccines, ergonomics, all of those things are, OSHA is our guiding light in that. Right, so we obviously have the OSHA record keeping handbook on our desktop. It's 183 pages, but we know it front to back. So what OSHA says about medical surveillance is it is a fundamental strategy for optimizing employee health. The fundamental purpose of medical surveillance is to detect and eliminate underlying causes such as hazard or exposures of discovered trends, and prevent those from happening in the future. They're usually clinically focused. So for example, whether it be medical and work history, post-offer physicals, physical assessment, biological testing, any information that's obtained from a clinical process could be used in monitoring and analyzing elements of medical surveillance. I'll get you to go to the next slide.
Hold on a second. I'll get back to you so shortly.
There we go. Got a little bit of a different view, but that's okay. Still effective. Thank you, Larry. The overview of medical surveillance is the process, again, for identifying potential hazards. Appropriate tests and examinations, whether it be questionnaires, physical exams, lab evaluations, pulmonary function tests, audiometric evaluations, and biological monitoring. So for us at Purdue, we're right in the throes now of hearing testing, our hearing conservation across Purdue. And I say we're right in the throes of it. Honestly, we start in January and our last van exits Purdue in November. So we're in the throes of it, I feel like every month. But it's a really important part of how we operate our business. Again, making sure that the associates are not put in harm's way, making sure that they have proper PPE, et cetera. So for us, these components here, we conduct medical surveillance for vision. So we utilize the TITMIS process in which we do vision screening for anyone in a safety sensitive position. It could be someone who drives a pallet jack. It could be someone who drives a jockey truck. Obviously, and it says here at the bottom too, we adhere to DOT examinations, but for those who are non-DOT CDL drivers, we do vision screenings annually on everyone in those positions. Hearing conservation, we utilize examinetics for hearing conservation. We also utilize a 3M validation system. So when someone at Purdue comes and there is a hearing shift, we not only refit and educate, or I'm sorry, we not only educate and train on proper placement of PPE, we also make sure they have the appropriate sized PPE. So for hearing, I hate to say it, some people have small ears, some people have big ears. And so we want to make sure that we properly size the PPE. So we use the 3M ear fit validation system for that. The respiratory process for Purdue is anyone who is on a hazardous material team, anyone who is in confined space team. We fit. We do a questionnaire, a clearance, pulmonary function test, and fit test all through our wellness centers. So anyone can safely enter any confined space or hazardous material spill safely. We also do the same for our medical group as well. We don't lean on the voluntary use of masks anymore. For Purdue, we require anyone who's in these positions to be fit tested. And of course, if they don't pass, we set them up with things like a PAPR or things like that so that they would be able to respond in case of a pandemic or any respiratory distress. The avian flu sounds foreign, but in poultry it is not. Around this time, sort of September, October timeframe, we start to put our sort of awareness up into the avian flu news, making sure that we're following flight patterns of geese. I know it sounds really strange, but that is very important to us. We ensure that folks who would, so for example, if one of our houses did contact avian influenza, there is a depopulation event that takes place in that scenario. We make sure that those folks who are put in that position are not only vaccinated with the flu vaccine, but also cleared from a respiratory perspective as well. Of course, we do DOT exams. We have about 700 drivers at Purdue, so we conduct exams throughout our centers. And then, of course, for well-being and biometrics, we have starting 2026 and all through open enrollment right now, we're promoting our Well Power program, which is a biometric screening campaign, and then referring into a diabetes management or smoking substance use program. And then, of course, our program continues to evolve. We ensure that we are staying abreast of any news when it comes to tuberculosis, job conditioning also, and chemical inhalation too, making sure that we are staying abreast of any OSHA changes. All right, next slide. So when you're designing a medical surveillance program, first you want to identify any hazards. And for us, we conduct a thorough risk assessment to identify any potential health hazards in the workplace. So it basically includes exposure to harmful substances, ergonomic issues, and other risk factors. Just helps you identify and prioritize hazards, take a proactive step in eliminating or reducing those hazards, and consider the specific hazards present in your industry and choose those monitoring measures that target those risks. For us at Purdue, it could be considered a hazard assessment, could be our daily walkthroughs. It could be, so we have a program called Power BI. And we just this year at the U.S. Poultry Association conference, I think we walked away with about 26 awards based on the Power BI method. So it it identifies and eliminates any risk factors immediately. So say, for example, we notice an associate is not proper placement for PPE. We don't write that down on a sheet of paper and take it back to the office. We sort of respond to that immediately. So that tool allows us to do that immediately. So next slide, Larry. Thank you. So for us, when we were designing our medical surveillance program, we wanted to really target the population who were at risk, right? So for us, it could be, again, I mentioned pallet jack drivers, it could be jockey truck drivers, it could be our DOT drivers, it could be our CDL drivers, it could be someone who's on the hazmat team, or someone who's an electrician, someone who's in refrigeration, right? So we go through those roles and we determine what the risk is for those roles. And then we make sure that, first of all, we need to know A, who's hired, B, what position they're going into, and then C, how do we support from a medical perspective after they're trained, right? So we make sure that we really stay in contact with HR and the safety leads to determine who's going where. And then, of course, we track all this information too, and we'll talk about that in a later slide. When we're selecting tests too, I'm going to make mention, selecting tests and selecting methods of entry into an occupational health management tool, you really have to determine sort of the parameters of that too, right? So you want to see, okay, is this going to be an annual surveillance? Is this going to be every 6 months, right? So the frequency and duration is really important when you're rolling out a medical surveillance program. And I do have to say that, I said in the beginning, we do use OSHA sort of as our guiding light, in making sure that we're adherent to any regulatory requirements. But we like to sort of go beyond that, right? So if OSHA says, hey, this person's at risk, we want to make sure that they have their respiratory physical every 2 years or as needed. We say automatically, no, we're going to do it every year and more often if there's issues, right? So we've got everyone sort of in a program here at Purdue where they're used to seeing the nurse in these safety sensitive positions at least once per year. Sometimes more often, depending on their health surveillance findings, but at least once per year. We want to make sure we integrate with other programs, right? So for us, it is not only the occupational health and safety programs, but DOT, OSHA, making sure that there's consistency in those programs. And then, of course, legal compliance too, right? We follow the OSHA and NIOSH guidelines, really for everything with occupational health. But for us, we make sure that associates also we follow the ADA guidelines too. So, for example, if someone comes in, they have to have a respiratory clearance done and they don't pass because there's a disability we were unaware of, we will reroute that person through a legal conversation to make sure that they're supported and they have everything that they need in that conversation. Again, not putting anyone in harm's way, protecting the associate, protecting the company. And that's what we do at Purdue. So next slide. When you implement a surveillance program, again, establishing the procedures, I have to say I've been in Purdue for 12 years. I think I've written, I collectively, the big I, have written a number of SOPs over the course of those 12 years. And really, it's about taking a proactive approach in establishing those procedures. Just don't write them and just hope they get read or hope they get applied to. We really review those at least annually to make sure things have not changed, whether in the occupational health arena, in the legal arena, in the safety first mentality arena, making sure that we establish those procedures and that they are actually followed and reviewed ever so often, at least annually for us. And then we want to communicate with the associate too. Why are we doing this? Again, at the end of the day, we're safety first, people first mentality. We want to inform the associate about the purpose of the program, let them know that the tests are confidential, how the tests are going to be used to operate our business, and what the test entails too. It's really important that we get the buy-in of the associate. And then we train and educate. I have to share that when we put in a respiratory physical surveillance program at Purdue, we went from every 2 years to every year. and you would think we were moving mountains. Honestly, it was a simple ask, making sure that we, again, proactively get in front of the associate to make sure that their health profile hasn't changed, right? A lot could happen in 2 years. So again, that buy-in of the associate, the buy-in of the supervisor, allowing the training and education to occur, making sure that we're communicating the importance of participating in the surveillance program, providing clear guidelines and instructions on how it works. And for us, because we do have this program run by our medical folks, it automatically puts some sort of legitimacy into the program as well, right? These are nurses who are trained to keep you safe and healthy at work. And this applies to your job in a professional level and also on a personal level too. So we make sure we communicate and train and educate our associates. And then, of course, that data collection and analysis is important. We use OHM today for our surveillance program. So again, when you're doing data collection, garbage in, garbage out, right? So if you don't have really thorough records, you're not going to get the mechanism of tracking that you're hoping for. For us, it's about collecting and analyzing data and then looking at trends and risk. You know, in our entry. So again, it serves its purpose. I can't say it is that we have really created a really thorough way of identifying trends, but we are definitely proactive when it comes to the surveillance program. We know that, for example, you know, Joe Smith is coming up on his vision screening, his hearing screening, his respiratory physical. We know that that's coming up in October, and we make sure we use OHM to tell us that, you know, and remind us of that. So we're not cleaning up anything. We're, again, being proactive. Next slide, please. And then reporting and feedback. You know, going back to our supervisors, our director of operations, our plant managers, and letting them know who's in the surveillance program. Again, not what the results were, but who's in. Who safely can respond to a hazardous material emergency, who safely can apply or respond to an avian influenza event, who safely can drive a pallet jack or a jockey truck, right? So we want to make sure that we provide that feedback over time. And so again, identifying those risks, making sure that we're adhering to protocols and outcomes. And then it said at the beginning of the hour, we don't have it all figured out, but we are really open-minded, learning from others, learning from each other on how we improve and ensure our surveillance program is effective and efficient. Next one. So key considerations when you're implementing a surveillance program. Again, I talked earlier about employee participation. They really have to have buy-in to the program. For example, and Larry, I know you got a beard, my friend. Sometimes when it comes to respiratory fit test, our guys with beards are sometimes like, I've had this beard for 25 years. There's no way I'm shaving. Purdue has made it mandatory that if you're not prepared at any given time to respond to an emergency, you would not be participating in our surveillance program. So that was a big undertaking. Again, safety first, people first mentality, making sure that the associates who are involved in these programs are adherent at any given time. That has been a big undertaking, is to make sure, again, from Purdue's perspective, that we're ready to respond at any moment in time. Confidentiality, because we do own and operate our own wellness centers here at Purdue. The associates trust our wellness center staff. Most of them have been around for at least 10 years or more, some up to 30 years. So there's definitely some trust that has occurred over time. We also make it a point to let the associate know that any data that we collect is handled with care. and that we are obligated to, protect our nurses' license and their certifications through the HIPAA regulation. And we let them know that anything that they provide to us, even though it is work related and job related, will stay confidential. So things like drug screen results, confidential, it's just a pass or fail. Things like respiratory clearance, whether you are retested within 6 months, a year, those results, it's pass or fail. But the results, the diagnosis are never shared. And so we make sure we let the associate know that they can trust our program. And then I mentioned continuous monitoring and integration. Um, Things evolve over time, right? Processes evolve over time. We, again, follow NIOSH, we follow OSHA, and we make sure that we follow DOT. And any new guidance that comes out from those regulatory bodies, we make sure that we apply that to our medical surveillance program. Next slide. Best practices for sustaining an effective surveillance program. It's vital to foster a culture of health. I had mentioned we are bringing back a program called Well Power. And so flashback to 2020, whoever wants to go back with me, 5 years ago, we had an award-winning program called HIP, or Health Improvement Program. We had about 92% of our associates voluntary participate in that program. We just basically gave them a water bottle and a pat on the back and a hug for participating, right? Along with their biometric screenings and some coaching with that program. We are bringing that back as of 2026 in a program called Well Power. It will be, again, biometric screening and the referral into coaching for either substance use or diabetes and weight management, blood pressure management. So we foster that culture of health here at Purdue. So this is a surveillance program is not anything unusual. The supervisors and plant managers know that anything health related, either from an injury prevention standpoint or even post injury, goes through the medical center. And so we have that culture of health here. We always encourage associates to provide feedback, and sometimes we don't even have to encourage it. They just like to give us feedback and suggestions for improvement no matter what, which we definitely are open to. Our associates, really the hardest working people I've ever known. And anytime they have feedback, we perk up and listen, because a lot of times, it makes a lot of sense. They're the ones doing the jobs, right? And then, of course, we collaborate with occupational health professionals. We have about 65 health professionals across our network, and 40 contract providers. So if there's something that we can't do in Purdue, we have resources to be able to lean on others. We have a lot of certified occupational health nurses as well, who are affiliated with either local or some of the local occupational health management programs. And so that helps too. They bring the expertise back and help us in assisting implementation and evaluation of a medical surveillance program. Next slide. Okay, so some of the trends that we're seeing across Purdue. About 50% of our population are in their 40s, early 50s, right? And so fingers crossed that they stay around for a long time, right? So age can be an adaptation that we are navigating, right? As folks get older, more limitations, maybe there's more chronic disease. That's something that we're always trying to assess. Access to healthcare. I mean, again, that's why we have these on-site health centers. We like to say that every associate has a nurse. It might not be outside your door, but it's by phone or by video, or every associate has a nurse. So access to care is important. Literacy and translation. We have, I would say at this point, we're up to about 15 languages at Purdue. Some of our locations have languages that we're just not used to, right? So we have resources available to be able to translate and educate associates in their language. Sometimes it can be more than language. It can be a cultural shift, right? Or it could be a cultural accommodation that would need to occur. So we make sure that we partner with local churches, local health departments who are used to working with populations that work at Purdue. Um, Again, another trend that we're seeing is prioritizing associates' mental health and well-being. We talked about the health conditions pretty early on. So our drivers in particular, those of you who have drivers across your company know the challenge of a healthy driver. We make sure that those drivers are well-versed in diabetes management, weight management, things like sleep apnea, right? All those things are important to the health of our driver, to the health of our business, really. And we make sure that the driver knows that these health conditions could affect their job. So we try to prevent a lot of chronic conditions from occurring, you know, with our drivers in particular. Safety culture, talked a little bit at the beginning. You saw our snippet from Jim Purdue and Kevin McAdams. It's a safety first mentality here. It's a culture shift for us. It's always been about safety. Now it is definitely from the bottom up. I would say that when I first started 12 years ago, it was definitely folks speaking from the top down, right? But now we're involving the associate. We're making sure that they are heard, making sure that they have input. And I would say from a bottom up philosophy, we're doing a good job here at Purdue. Technology trends are always ever changing, right? I think we've looked at a new EMR or an update to our EMR 12 out of 12 years I've been here. So, you know, we're always looking for new monitoring devices, newer technology, particularly as the world changes, right? I mean, probably some of us before COVID would have never dreamed of visiting with a virtual doctor, right? I'm still not sure if I'm ready for that yet, but we are moving into the future there, right? So technology can be a challenge as well. It's a trend we're definitely keeping track of. And then our vendor partners. As our population changes, as their conditions change, you know, we have to look outside of Purdue to bring vendor partners in that support the conditions of our associates. So, next slide. Of course, the resources here, CDC and NIOSH, National Library of Medicine, and OSHA, our friends at OSHA. And there's some awards that we've won here at Purdue. Yeah, our folks are pretty spectacular. They always got an award in their center somewhere. So that's all I had today. Larry?
Okay, thank
Opening
you
up for
very
some
much.
Q&A?
That's
Sure.
great. Yeah, let's
Yeah.
so everyone will get a copy of the slides as well as a link to the recording. So you will have that available to you. What I like to do now is just go around the table, and if you have questions for Dawn or comments or experiences you want to share, please do so. I have B. Dukar. If you would like to make a comment or question? All right. Bridget, any comments or questions?
No, sir,
Bridget?
I'm good. Thank you.
Okay. Jamie Hyatt, any comments or questions? Jamie, any comments or questions?
I do not. Thank you.
Okay. Kendall Rosemeyer, Kendall, any comments or questions?
No, nothing here. Thank you.
Okay. Laura Spalding, any comments or questions?
Yeah, I just want to say that that was a fantastic overview of your medical surveillance program at Purdue. Really impressive. Yeah, I'm curious about the segmentation of the wellness and biometrics information and how you're able to separate that from the med surveillance information because it's so challenging to see patients and to identify personal health conditions and then to document that separately for sites, especially in OHM. So I'm just curious how you're able to do that well.
Yeah, thank you for the question. It is a challenge day by day. Um, so, so we definitely engage with our legal team when it comes to the operations of our wellness centers. It's funny, when I first started 12 years ago, I came from long-term care, which was highly regulated, right? And so I was used to sort of that regulatory arm over a medical practice. So when I came to Purdue, myself and the regional nurse managers who work alongside me had the same mentality, right? So let's create a medical world in which we are protected, right? The nurses are protected, our company is protected. So we really partner with legal quite a bit in discussions, even around our EMR, the associates that we see, the way we communicate results, even things like storage of medical records, which we don't have storage anymore, but even things like that. How do we create in OHM a divide between what safety can see and what the primary care function can see? And so it is an ever evolving conversation. I do have to say that Pure Safety UL, who hosts OHM for us, has really helped us build an EMR. I put it in air quotes, an EMR that allows us to have that segmentation. But good question. Our providers see folks for work comp and for primary care and for biometric screenings, and we make sure that there is a constant division of data to make sure we're not sharing anything that's inappropriate. And as a matter of fact, I would also mention that even when it comes to, there's some leniency around things that you can share from a work comp perspective, from a drug screen perspective, and we don't share any of it. It's pass fail, that's it. And so we make sure that even from a work-related standpoint, we protect the company for sure. But good question.
Thank you, Don.
Yeah.
Thank you. Michaela, comments or questions? Michaela, any comments or questions? No? Nick Sire, Nick, any comments or questions?
Hi, yes, thanks for calling on me. A great presentation, really enjoyed it. I have a question. So we work for Intermed. We contract with LL Bean up here in Maine, and we provide a workplace health center that's like on site for LL Bean employees based out of their order fulfillment center. We do multiple things, including the biometrics and health screenings. We do a pretty extensive preventative vaccine program up here. We provide occupational health amongst PT and other services like that. So we're working at trying to kind of revamp and redesign our workers' comp, like occupational case management program up here. And I just was curious, we're kind of exploring programs and offerings and would be curious what you'd have to say about OHM, about their case management modules, or if they have any tools that would be useful for tracking workers' comp cases and kind of managing the case that way.
With Gallagher Bassett, who is third-party administrator for work comp. So we really lean on their program to be able to receive documentation, send documentation, things of that nature. OHM allows us to document from a primary care perspective. We have encounters over on the primary care side of OHM that allows us to facilitate our business. So things like med refills, labs, things like that can be done on the primary care side of OHM. OHM's beauty really is the occupational health management side of that program, of that space. And so for us, it's about OSHA record keeping. It's about keeping the the 300 log in OHM. It's about keeping the state work comp forms in OHM. So I would say that it does a 10 out of 10 job on the work comp and the medical surveillance and the occ health side, OSHA record keeping side of the business. Where we sort of built our own is the primary care function of OHM. So I do think we probably would get a B- on that right now because as technology changes, we need to change with it, right? So things like discharge instructions, right? Sound super simple. It's not in OHM. So we're working with OHM to make sure that they meet our needs in that program. But I would say again, from an occ health standpoint, work comp standpoint, OSHA record keeping, 10 out of 10.
Awesome. Great. Thank you, Don.
Yep.
Thank you, Nick. Michaela, did you want to comment? May I have a question?
Yes, I'm so sorry. I was struggling with my microphone. Are you able to hear me?
Yeah, go ahead.
Oh, great. Thank you so much. So first of all, thank you for the info. This is great. Being newer to my role, I can use everything I can get. Again, I was struggling with some sound earlier, and I think you may have answered this 2 questions prior. One of the issues we've come up against here are medical records release, and I think I caught the tail end of this. Things like drug testing, surveillance programs. Do you allow access to that or unhindered access to medical records, or is that something that you keep sort of as an employment record?
Yeah, so we do keep them separate. So again, all of our nurses are HIPAA trained. So any medical record that is obtained from the primary care function of Purdue, that is kept in OHM. And so, that is protected for sure. We also, from an employment perspective, things like drug screens, respiratory clearances, even the questionnaires, we also protect. That does not go in an employment record at all. It stays directly in OHM. It's on the primary care side of our business because that's really the function that we do. So nurses are doing drug screen, doctors are doing the surveillance, right? So we keep that on the primary care side of the business.
Got it. Thank you so much.
Yep.
Thank you. Nick Justice, Nick, comments or questions? Nick Justice, any comments? No? Rick Maching, Rick, any comments or questions?
Sure. I'd like to say thank you to Dawn. I thought that was a very informative presentation. Thank you, Dawn.
Yeah.
Just a question. You mentioned there's 20,000 associates. Is it fair to say that all of them have been to one of the health centers?
Well, I would say it would be fair to say it. I don't know if it would be accurate to say it. And to be honest, that's what we're trying to revitalize is that that HIP program with WellPower. So again, we saw about 92% of our associates at least one time a year in 2020. And we're going to be bringing that back. And I know we can do it. So I would say that our utilization is around 15%. And to me, that's super, super low. Of course, we are about 97% of capacity, right? So we don't have doctors 40 hours a week full time, right? So some are part-time, some are 2 days a week, et cetera, et cetera. So for us, we measure on utilization as a percent of capacity, and we're about 90% utilized from that perspective. But that's what we're going for, is that 92% participation in our biometric screening. We'll report again next year and see where we are.
Sounds good. Thanks very much. Rob Goldsmith, Rob, comments or questions?
Thank you very much for the opportunity. I actually have 2. The first one relates to chemical exposures. And I know it was mentioned very briefly, and I suspect that there are lots of chemicals used in the processing plant and cleaning. How are those medical surveillance evaluations structured? How are they done? Is there any exposure monitoring to determine who's truly exposed and who is not exposed above the action levels?
Um, Great question. So I should preface it by saying that a lot of our sanitation is done by a third party, right? So that third shift, first shift comes in and sanitizes Purdue as we prepare for production. So they have their own sort of monitoring program when it comes to exposure. For us, the exposure really is in the live location. So again, if you think about it, the chicken and the egg, right? First, we've got seed, and then we've got the egg, and then we've got chicken. We've got all these parts of the business, right? So for us, there's a high propensity for PAA exposure that goes back to that hazardous material group, making sure that anyone who is on that hazmat team has respiratory surveillance. We also in our live group have formaldehyde. Not all of them. I would say our hatchery group, we have formaldehyde. Not all of them, but those in which we are exposed to, we make sure they go through the respiratory clearance as well.
And it's just it's limited to the respiratory clearance program. There's aren't any other elements for the chemical exposures for the formaldehyde and PAH.
Correct.
Okay.
Yep.
My other question, if there's time,
Sorry, it's by my desk.
regarding reproductive health. Do you approach medical surveillance in reproductive age or pregnant employees differently?
Yes, we actually do. And I apologize. I thought I took myself off camera. My computer was about to go dead, so I'm making sure I've got it plugged in. So, full transparency there. The little light came on and said, please help. So I'm all set. Yes, we actually take into account not only that, but then also the demographics of the associate, right? So if they are Asian American or if they are African American, right? So there's different parameters that we use for our surveillance program. Again, all sort of by the standards of OSHA. So things like the tests that we perform on those associates are not different in a way, but we just make sure that the readings are analyzed knowing the demographics of that person. But yeah, and of course, pregnancy, if any of our folks are pregnant, we do obviously treat them the same, but there is some limitations there. So we're not going to have someone who's pregnant on the hazmat team during that time or in a ID pop team at that time. Right. So we provide accommodations for those associates until they have delivered. Right. So again, keeping them out of harm's way. But yeah, that we definitely do base some of our decision making on the demographics or also the health condition of the associate as well. So for example, if we have someone who has comorbidities, right? They might not pass a respiratory surveillance program, right? But their job depends on it, right? So we have accommodations through legal that they can request, we have conversations through legal that they can request accommodations in that time period as well. And of course, then we put them over with our provider to make sure we're preventing any further chronic condition, right? Try to relieve them of that issue if we can. So, but good question. And yes, the short answer, yes.
Thank you very much.
Sure.
Thanks, Rob. Tony Musi, Tony, comments or questions?
No, I joined really, really late, Larry, so no, thank you.
Okay. All right. Any other comments or questions for Dawn or that you want to share with the group before we close the session? Anyone? If not, again, Dawn, thank you very much
Thank
for your
you.
time and effort and your expertise. We all very much appreciate it. A
Sure.
copy of the link of the presentation and the recording will be sent to everyone who registered for the program and available to NOWIC members on the website. Hope you'll join us October 15th for our next session. Look forward to seeing you all in the future. Thank you very much. Have a great day. Bye-bye.
Okay.